Back. May is Mental Health Awareness Month, and many people are still feeling the effects of this pandemic. Help is available for adults as well as children. And joining us now to tell us more about that is Carrie Krawick, a licensed marriage and family therapist with Birmingham Maple Clinic in Troy. Thank you so much for being with us today.
Thank you for having me.
First of all, whether it's anxiety, depression, you name it, what are the concerns that you've seen the most now more than a year into this pandemic?
Absolutely. I think it ranges from different people at different ages and stages of their life, but certainly families navigating the increased tensions of, organizing events or things that include people who have different feelings about the pandemic or different levels of stress or anxiety about it. That causes a lot of conflict and stress and fear that you could perhaps infect or be infected by someone who's very close and important to you. Young single people feel extremely isolated. They feel depressed. They feel their life is on pause. They're hoping to sort of advance things like their career opportunities to travel, maybe date and marry, and they just feel absolutely stuck this year.
How about seniors, for example? This has been an especially tough year on them as well.
Sure, absolutely. I think some have actually been very equipped to find ways to thrive in new ways and adapt. But yes, others have been isolated, have been scared, and have been, many ways, feel left behind of their family and maybe even other people that they cannot necessarily catch up to, the new technological ways and prefer just maybe the older traditional ways of meeting and getting together.
And that has been, stifling those social interactions. And hopefully now that much of that population has been vaccinated, they're getting out and being able to interact a little bit more. And when you look at adults, the ones who are, feeling especially down or stressed out, that work-life balance, so many trying to juggle, their job and also kids who've been learning at home. What are you noticing most there?
Sure. Well, I think for a lot of people right now, as we're approaching reentry and return to work, there's a great deal of anxiety about what that's going to look like. Our lives came screeching to a halt, but we eventually adjusted, and now we're going to have to adjust to them moving back again, which is also very stressful to think about. Navigating workplace politics, balancing that with if your kid's school model of hybrid, or if someone, tests positive and then you shut down for 2 weeks. So people are sort of forecasting all of the potential things that could happen, and they're feeling very anxious and stressed about it.
And when a child is in a place where they probably need the help of a therapist, what are some signs?
Oh, absolutely. I mean, I think children are experiencing a great deal of loss and anxiety right now, just uncertainty and confusion about what this all means. Separation anxiety is something we're seeing. Kids who were home with their parents for the last year are now getting thrust back into the world, seeing very little of their parents again, and are feeling sad and uncertain about that. And I think any major changes in behavior, loss of interest in activities that were once enjoyed, obviously increase for younger children, increased complaints of like stomach aches, headaches, nighttime bedwetting, things that are just a change. Certainly any talk or thoughts of death or hurting themselves or not wanting to be alive would absolutely be a concern for any person at
Sure.
any age. I always advise people to just be really bold. If you have any reason to suspect someone's at risk of hurting themselves, just ask them straightforward. Don't dance around the subject. Ask them straightforward and guide them to the help that they need.
And you have resources to help. Where can people find you?
Sure. I'm at Birmingham Maple Clinic in Troy. We have a website, birminghammaple.com. One of the gifts of this pandemic was that now mental health is so accessible. You can Zoom, you can go in person, you can do it via phone. There's really no excuse not to at this stage.
Lots of options to help people out. Carrie Krawick, thank you so much for joining us this morning from the Birmingham Maple Clinic. We do appreciate it.
Thank you so much.